Thanks to medical advances, the odds are improving for breast cancer survivors, but there's also a larger racial gap these days with higher mortality rates for women of color. In Dorchester, the Codman Health Center is expanding efforts to narrow the gap with a grant of $100,000 from the American Cancer Society and the New England Patriots. To tell us about the grant are the health center's chief technologist and manager of radiology, Eileen Boyle, and from the Cancer Society, the health systems manager for primary care systems, Korey Hofmann. Thank you both very much for being with us.
Thank you.
I'll start with Korey. This is a national program, and tell me about the reason for this.
Well, nationally, there are significant gaps in the mortality rates between African American and white women, and so this grant opportunity is really in direct response to try to address those mortality gaps. The grant is really designed to improve access to screening, but also access to timely follow-up care and treatment for breast cancer.
I mean, if the gap is in what happens after screening, because there's equal access to screening more or less, what's going on?
Well, what we see at Codman Health Center and my wonderful staff who diligently reach out to our patients, it sometimes is very difficult to get women in because they're primary caregivers in their homes, and they're so busy with so many other priorities, especially when you're in a low-income bracket. The last thing they're thinking about is having their mammogram done. So with this grant, we're so happy that we have it through American Cancer Society and Crucial Catch. This will allow us to hire a staff person that will cycle back constantly and make sure that those women come in. If I can give an example, I had a woman come in yesterday with her daughter, her mother, who was a breast cancer survivor, and her father. It was wonderful to see that support system. The woman was so anxious about this test. We got through it great. She was far more relaxed going out the door. So that is a success story. So that's what we like to see. So moving forward, this woman will again come back to us, and we'll realize that this is what she needs to do to keep herself available to her family.
Korey, I know scheduling can be a challenge if you're essentially running a family, but what about some of the other challenges that survivors face to getting the treatment they need?
Well, I think similar to barriers to cancer screening, barriers to treatment include transportation and childcare. Those are often really significant, as well as barriers related to costs, like copays around treatment. And so this grant will also support the health center in just helping to mitigate those barriers. So helping work out transportation arrangements. If the hospital where a woman is getting diagnostic screening, or treatment, often those institutions will also be supporting their patients, but it's really because the primary medical home is the health center. This grant will really support the health center in making sure that their patients are attending their scheduled treatment or diagnostic exams.
Eileen, when people are mostly healthy, $25 or even $40 here and there for a minor problem is not too painful, but when you're getting treatment for breast cancer, what are we talking about with copayments?
Right. We, as caregivers, we have to be very conscious of how their appointments are lined up, because you don't want a patient coming in just for results of tests and having to pay $20. That's too expensive for them. Fortunately for mammograms, for the most part, there is no copay for most insurances. But we keep that factor in. If a patient has a screening at Codman Square and has to go to Boston Medical Center, there's a system that Boston Medical Center has set up where they can actually get an Uber ride from our site to Boston Medical Center and back, and that is paid for by Boston Medical Center. So that is something that we need to make sure that our patients know for follow-up.
This has been News, and we're talking with Eileen Boyle from the Codman Health Center and Korey Hofmann from the American Cancer Society. Korey, I know there was some controversy in recent years about which women should get screened, when they should get screened. Any advice for viewers here about this?
Well, I think our advice is to talk with your doctor about what is really the appropriate screening schedule. The American Cancer Society really recommends beginning 45 annual mammography, and certainly it's annual mammography starting earlier for higher risk patients. And then women can, as long as they're average risk, are also able to get screened every other year or every 2 years.
I mean, I guess another reason why it's important to talk to a doctor, starting with a primary care physician, is that you're going to be asked about family history. You have relatives who had some kind of a problem, right?
Right, exactly. That puts you in a different category. So, in May we had a Mother's Day event, and we had a patient, not a patient of ours, but a young woman who attended, who was diagnosed at 35 for breast cancer, who did not have a family history, but even though she was being treated somewhere else, she was so happy that she attended this event, because she was educated not only on breast cancer itself, but how it affects the African American community. She didn't realize that women were not being diagnosed in time, so they weren't surviving. Basically, they were being, so that is educational. I think that we're going to continue to do that and get the word out, so that a lot of times word of mouth is some of the best policies too.
I mean, I know Korey mentioned the racial gap in survival around the country, but is it that bad in Boston, or is it different?
No, we're far ahead of the curve, I think, in Boston, but we still have many patients who don't know to get their care, because we still have an immigrant population. I have women that come in, have never had a mammogram, and they're 60 years old. It's the first time that they're being seen. So, we need to make sure that we're treating everyone and getting the best care, so that they get the best care possible.
Korey, there's also been a comparable collaboration with the South End Health Center around cancer prevention and detection. Can you tell us a little bit how that's working out?
Sure. The South End Community Health Center received a similar change grant funded by the NFL Foundation and administered by the American Cancer Society in 2017. And they have already exceeded their screening targets for colorectal cancer screening and breast cancer screening. So they're doing a phenomenal job of both outreaching to their patients, and also some of the funding really supports internal processes. So looking at all of the components of their workflow to make sure that physicians are making that recommendation at the appropriate time for their patients, and then they're ensuring that patients get the test completed. So all that all those components of care are really being attended to through their work, and they're doing an excellent job.
We should mention, Eileen, because you're familiar with what's been going on at the health center, you've got a lot of different kinds of services tailored to the community. Anything we should tell viewers about some other things going on there?
Yeah, I think sometimes health centers are underrated. I am extremely proud of where I work. I mean, not only have radiology care, we have urgent care, we have family medicine, internal medicine, pediatrics, eye care, dental care. We have wonderful doctors that do pain management with acupuncture and meditation. We have a wonderful nutritionist that does classes for hypertension and diabetes. And then, of course, we also have a school that's attached to our building. So a lot of the students that are in the school get care from our behavioral health department, or from the physicians themselves. So we're kind of a community within the community too. So it's been a great, I think, working model, like patient-centered home model for everyone, really.
And Korey, even looking beyond any particular health center, as far as helping women get to screenings, or at least transportation, is there something you want to say about that?
Well, I think, as Eileen mentioned, Lyft and Uber, I think, are new services that are available, within Boston, and I think in many other parts of the country, becoming increasingly available through partnerships, both with the American Cancer Society and other healthcare organizations. So I think it's an exciting model to see that transportation assistance in such an easy to access format. Many people, do use these kind of ride-sharing services already for personal use, but then to have them sometimes the cost covered through the hospital or healthcare organization.
Should they
important.
call the Cancer Society about information on that?
Absolutely. We have an excellent referral service. Our organization has a 24-hour-a-day information line that can be accessed at 800-227-2345 or on our website. So there's information about both rights to treatment and other referrals to assist patients to get transportation to screenings.
And Eileen, if people want information about the breast cancer program at Codman Square, is there some way they can do that too?
Yeah, they should actually call the radiology department directly. That would be easier. It's 617-822-8147.
Thank you both, Eileen Boyle and Korey Hofmann.
Thank you.